Equine Dental Vets, and we're here at the Equine Podiatry and Lameness Centre in Muswellbrook, New South Wales, Australia. And I'm talking to Luke today about tendon issues in horses.
Thanks.
So, Luke, fire away.
Thanks, Shannon. So I think today we're just going to go through some common tendon injuries in the horse. Obviously, injuries of the tendons can be a cause of lameness in the horse. So I think we can go through a basic process of looking at some of the anatomy, the clinical signs, diagnostics, and some treatment.
That's great, Luke.
Cool. So your horse has been diagnosed with a tendon injury. You can go for the following options in terms of treatment. Your initial treatment, regenerative medicine options, rehabilitation, and therapeutic farriery. So your horse has been diagnosed with a tendon injury. So initially you can treat the horse with some cold hosing, supporting the limb with a stable wrap, and you can also use anti-inflammatories when prescribed by your veterinarian, such as phenylbutazone, commonly known as Bute. One of the initial treatments for a tendon injury is to cold hose it. Everyone's got a hose in their backyard, and you can do it before the vet arrives just to try and reduce some of the swelling and inflammation associated with some of these tendon injuries. Your horse has been diagnosed with a tendon injury. One of your options later on, after the initial treatment phase is finished, is to inject the tendon with some regenerative medicine options. These options include platelet-rich plasma, PRP, or stem cells. Both of those options are naturally occurring products that can be used to reduce inflammation and aid in the healing process. So platelet-rich plasma, or PRP as it's commonly known as, is collected from basically a venipuncture. We collect some blood from your horse. The blood is then processed in our laboratory, and the platelets and the products that are associated with the platelets, such as growth factors and anti-inflammatory proteins, are then concentrated into a form that we can inject directly into the tendon under ultrasound guidance. The reason that we inject tendons with the PRP is because the studies have found that it reduces some of the inflammation, and it can aid in the healing process by aligning the collagen fibres better. But that's the real main reason why we like to do that.
So Luke, in regards to PRP, basically, as an owner, can you explain to me how my horse will respond to PRP, or why I should have PRP injected into my horse if my vet recommends it?
Sure, Shannon. Basically, the reason we inject PRP is to aid the healing process and to reduce the amount of scar tissue. So scar tissue is bad when tendons are healing. It's a weak point, and if we can try and control the amount of scar tissue forming, then we are likely to have a better outcome with your horse's lameness issues.
So, in summary, my horse might, if the case is appropriate, get back into work quicker or have a prolonged career?
Yeah, the prognosis is better if there's less scar tissue formed.
So stem cells are a bit of a hot topic, Luke. There's obviously use of stem cells now in humans, cats, dogs, and even horses. So can you just explain a little bit about what might be involved if I, as a horse owner, come to you and one of the options that you might recommend for my horse is stem cell therapy?
Sure. So the reason we're injecting these stem cells into these injuries, there's been a lot of research done in the past few years on these in humans, dogs and cats, and horses. And we're starting to think that maybe the cells turn into tendon cells, and that can stop and reduce some of the scar tissue formation. Or maybe they have some anti-inflammatory proteins that they supply to the surrounding tissue. Again, really just trying to stop all that scar tissue. As we discussed with the PRP, scar tissue is a weak point, so we really don't want that to form when we're trying to heal these tendons. I think if your horse has a tendon injury and you want to try and have the best possible result, some of these regenerative medicine options are a good idea. So your horse has been diagnosed with a tendon injury. Your initial treatment options in many cases are to try and reduce some of the inflammation and swelling around the tendons. So a good idea is some cold hosing. You just get your plain old garden hose and just hose the tendon for say 10 to 15 minutes once or twice a day. The second option you can do is put a support wrap on that will stop some of the swelling accumulating in and around the tendons. And the final option, if you've had a veterinarian out, you can use some anti-inflammatory medications to try and reduce some of that inflammation surrounding the tendons. Something like phenylbutazone, commonly known as bute, can be used at low doses to reduce the pain and swelling. When dealing with the rehabilitation of tendon injuries, it is important to consider the condition of your horse's feet. Long toe, low heel, hoof conformation can increase some of the strains in some of these tendons. So it's a good idea at a very basic level to have your horse trimmed on a regular basis. Some other tendon injuries, such as injuries to the deep digital flexor tendon, can require a specific shoe, such as a raised heel shoe. This can reduce the strain on the tendon and aid in the healing process. Your horse has been diagnosed with a tendon injury. A rehabilitation program is a good idea. To begin with, some horses are rested for up to 6 to 12 months without having any work. However, my thoughts are that it's probably a good idea to begin with a rehabilitation program and a graded exercise regime so that it reduces the amount of scar tissue formed and increases the likelihood that your horse will become sound after the period of time. To begin with, initially we can start with a hand walking regime whereby the horses walk for 5 to 10 to 15 minutes per day, either in hand or with a walker. And then we can go on to things like trotting and cantering later on in the rehabilitation program. Throughout the rehabilitation program, it's a good idea to have the tendon ultrasounded. This can allow us to see whether the tendon is healing properly, if the lesion is becoming smaller, and whether the fibres in the tendon are becoming aligned rather than a big black hole there. Tendon injuries in the horse can be a cause of lameness. Horses can be predisposed to tendon injuries depending on what activities they're involved in. Some horses, such as race horses, can be more predisposed to superficial flexor tendon injuries, whereas horses like performance horses in eventing or dressage can sometimes be more likely to have a deep digital flexor tendon injury. So I think a lot of the times it depends on the intensity of work and the type of work will depend on what tendon and how badly injured these tendons can be. We know that with superficial flexor tendon injuries in the racehorse, there's thought to be a degenerative process, so the fibres in the tendon begin to break down over a period of time. This may be increased by a higher intensity of work. And then in some cases it may just be a complete freak of nature. They may stand on something the wrong way or they twist their foot wrong and they can injure their tendon. The clinical signs of tendon injuries can vary. In particular, superficial flexor tendons have a bowed tendon appearance, so the tendon starts to look very swollen. You look down the side of the leg and it actually bulges out. Some injuries, such as the deep digital flexor tendon, may be a little more subtle. However, they can sometimes have an increase in fluid in their sheath that surrounds their fetlock and pastern. Depending on which tendon and how serious the injury is will depend on the clinical signs. In terms of a lameness, some lamenesses can be severe and others may be mild. It really depends on the injury and how long it's been going on for will determine how painful the injury is. It's really important when you notice any of these signs to get your vet involved as soon as possible. You've had your veterinarian out to look at your horse for a potential tendon injury. We can do a few things to further our diagnosis of the lameness. A good idea is to have the horse trot up and down in front of you. If you go to equinedentalvets.com/TV, there's a nice video on there that goes through the specifics of the lameness examination. Another thing that we can go through are nerve blocks. This can help us localise where the pain is coming from. And then finally, if we suspect a tendon injury and we've localised the pain, we can then look at the ultrasound images to try and determine the severity of the lesion involved and which tendons are involved. Here we have a horse that has a superficial digital flexor tendon lesion. This is the superficial flexor tendon here, And in the middle you can see this dark spot. That's an area where the tendon fibers have been torn apart. And also what we can see is the superficial flexor tendon is actually much larger than it should be when you compare it to the other leg or a normal horse. This horse is suspected of having a tendon injury, so I'm just looking at the tendon structures. As I move my probe down, I can change the angle and look at different tendons and different parts of the tendon. And basically, we're looking for any irregularities or lesions in the tendon. Here we have a normal ultrasound of the tendon structures at the back of the front leg. Here we have the superficial digital flexor tendon, the deep digital flexor tendon, the inferior check ligament, and the suspensory ligament. Here we have a horse's leg, and I just want to point out the tendon structures that we've got here. Here is the superficial digital flexor tendon. Below that is the deep digital flexor tendon. The check ligament, the inferior check ligament runs in here, and this is the suspensory ligament here. At the front we have our extensor tendons.
Okay, well that's it from the Equine Podiatry and Lameness Centre in Australia's Hunter Valley with Dr. Luke Wells-Smith. So thank you very much, Luke, for a very informative afternoon of tendon injuries. Cool, thanks everyone for watching. No worries, don't forget to watch equinedentalvets.com/TV for more updates.